Everyone. Thank you so much for watching my first video on MRCS ENT. I was blown away by the response. I got a lot of questions. So, considering the questions I got, I felt I should discuss about why one should go for MRCS ENT after MS ENT in India. After all, both MS ENT and MRCS ENT can be considered to be equivalent degrees. So why MRCS ENT once you've completed MS ENT in India? And by MS ENT, I do also consider DNB in the list because DNB and MS are equivalent. So why should really someone after completing post-graduation in ENT go for MRCS ENT? So let's talk about this in more detail in this video. What do we see here? This is a flow chart showing the surgical training pathway in the United Kingdom. So unlike India, where we have the MBBS curriculum for about 5.5 years, and then we have the entrance exam after which we have the 3 years of post-graduation. In the UK, the scenario is slightly different. In the UK, after MBBS, there is 4 years of training instead of 1 year of internship. United Kingdom has 4 years of training. There are 2 years of foundation years, FY1, FY2. The FY1, FY2 you see here. Refer this one here. These are 4 years after MBBS for simplicity's sake. Foundation year 1, foundation year 2, and then 2 years of core training, CT1, CT2. Following which they start with something called specialty training, which starts at the ST3 level, goes all the way up to ST8. So ST3, ST4, ST5, ST6, ST7, ST8. That's almost 6 years of training to become a consultant. Only at the end of these 6 years does a doctor in the UK get a chance to become a consultant by following the training pathway. And again, this is the surgical training pathway. There can be minor variations to this pathway, but largely this is how it is followed. Now, if an Indian doctor who has completed MS ENT now appears for MRCS, or even an Indian doctor who has not completed MS ENT and manages to get the MRCS diploma, he or she can directly join the training pathway at ST3 level. They don't need to go through all these 4 years of training. They can go directly to ST3 because somebody with MRCS is considered to be eligible to join the training pathway at ST3 level. So it can appear appealing to some people who might be struggling with the postgraduate entrance exams in India. I don't know, but this is how it is. So after primary medical qualification, if an Indian doctor can clear MRCS, then they can join the training pathway in the UK at ST3 levels. Then 6 years of training and then consultant in the UK. Now, here it is important to mention that in the UK, the term consultant is for somebody who has completed the specialist training pathway. In India, the specialist training pathway, or post-graduation as we call it, is largely 3 years. And at the end of 3 years, we often call ourselves consultants. So the word consultant is for anyone who has completed post-graduation in India. But in the UK, it is only after one has completed 6 years of training and has cleared the FRCS exam. So MRCS gets you entry at ST3 level, and FRCS at the end of the training pathway helps you become a consultant. So MRCS is the entry exam and FRCS is the exit exam. However, apart from the training pathway after MRCS, doctors from India can join, and from the rest of the world as well, can join something called the non-training pathway, which does not follow this kind of a structured plan. Based on the interviews, a non-training doctor can work in a setting where they can largely work as a specialist, but not as a consultant. So again, you can work as a specialist, but the designation will not be that of a consultant. And while you're working in the UK, you can gather the necessary evidence to maybe switch back to the training pathway at a level somewhere here, or you can continue working in the non-training pathway, gather the evidence, and there is something called the CESR route to become the consultant. More on that will be discussed in some other video. So the first thing one can achieve by getting MRCS is join the surgical training pathway in the UK somewhere around here in the ST3 category. Moving on, it needs to be mentioned that MS in India is not an internationally recognized credential so far. However, MRCS is recognized in many countries of the world. Maybe it does not give equivalency to work in major countries like Australia or New Zealand, but the fact that you have MRCS will embellish your CV when you are trying to go and work in some other country. MRCS is of course recognized in the United Kingdom and in Ireland, but it is also recognized in countries like Singapore and some Middle Eastern countries. But if you are trying to go and work in Australia or North America, the fact that your CV consists of an MRCS will give you some kind of credibility. Although you will have to pass the necessary exams for Australia and North America as well. But it is a degree that they do consider valuable. And of course, it is something which helps you join the training pathway or the non-training pathway in the UK and Ireland. So this is a degree that is internationally recognized, unlike MS ENT in India. So that is also a reason why you might want to explore this option. Now, there are some membership benefits. Each Royal College, there are 4 as I mentioned, one in London, one in Edinburgh, one in Glasgow and one in Dublin. Each Royal College has its own benefits for its members. By benefits I mean they provide career support, career advice, they provide the opportunity to access their library, access their publications, and in some cases they also help in some fellowships. So there are fellowships in India, for example, one in Bangalore and one in Pune, where people with MRCS can benefit, but for benefit may get an edge in terms of joining perhaps, but this is not very clear. But these fellowships are mentioned on the Royal College website, so you can go through them. There are some fellowships in the UK and there are some in India. So these are some of the benefits that you can get if you just want the MRCS and do not want to pursue a training pathway or work in the UK. So you still get some benefits too, or some sort of edge when you apply for these fellowships. Now, bottom line, let us analyze the pros and cons. No particular decision or certainly a decision of this magnitude can be considered to be straightforward. It has its own advantages and it has its own disadvantages. Let's go through them one by one. This is a list by no means which can be considered to be exhaustive. It's just a list that I felt might help you make up your mind. And again, it's an individual decision. Think of your own situation, think of what you want in life, and then decide accordingly. I am no one to tell you what you should do. This is just an attempt to help you understand what the situation is, as I see it. Okay. With that out of the way, let's discuss the advantages and disadvantages of pursuing this MRCS pathway. So let's first discuss the points in favor, why you should go for MRCS ENT after MS ENT or even after MBBS in India. So again, as I said, this MRCS exam helps you gain entry into the specialty training pathway in the UK. You can train to become a specialist in the UK, and maybe their training pathway is slightly different from the way we are trained in India, but getting exposure to their system and how they follow patient care norms, it might be a worthwhile experience for any doctor anywhere in the world. Again, working as a doctor in the UK is possible with MRCS. Even if you don't want to work as a trainee, you can go and work in the non-trainee pathway where you get to work as a specialist, and depending upon the department and how good you are, you'll get to work more and more independently. As I mentioned, there are some fellowships and there are other benefits that each Royal College provides to its members. And if not anything else, you get to use the MRCS post-nominals after your name. It certainly looks good and it certainly embellishes your CV, and you can always tell your employer that you have um, proof that you are competent internationally. So it helps you tell your prospective employers how competent you are. And again, as I said, some countries like Singapore and some Middle Eastern countries also recognize MRCS. Now, the disadvantages. It has to be acknowledged that this is a relatively expensive process compared to pursuing post-graduation in India from the government setup. So not only is it expensive in terms of exam fees, it's also expensive in terms of the preparation, in terms of going to the UK for appearing for the exam, the visa. So all these factors do come into account. And once you are in the UK, you have to adjust to a new country, a new society. There might be a language barrier depending upon where you are coming from. And you also have to adjust to a healthcare system which might be quite unfamiliar, because NHS is an amazing healthcare system, but it might be quite different from where you are originally working. So that also requires some adjustment. The training pathway is longer than it is in India, and it is also more competitive to get into. There are, especially ENT is a very competitive branch, and there are interviews where you have to prove that you have the necessary evidence and you have a good enough portfolio to join the training pathway. More about the portfolio in some other video. And again, it has to be emphasized that your own personal circumstances may not allow you to go to the UK. Maybe you have family issues, maybe there are some other factors. So you have to decide this on your own based on your individual situation. I'm just giving you a list of things that you should consider before you make a decision one way or the other. I hope this video has helped answer some of the questions that might have remained unanswered with my first video. If you want more clarification, I'll be happy to answer your questions in the comment section. Thank you so much for watching. See you in the next one.